All right, everybody, welcome. Thank you for attending the December session here for Campus Mental Health Echo. Really appreciate everybody turning up. Know it's holiday season and everything's ramping up, so appreciate you taking the time. We got a full session. We have a didactic presentation by Dr. Michael Brummage, and then we have a participant topic discussion by Dr. Carol Smith. So we'll get into that in that order, and then we'll wrap up and kind of look towards 2023 and what to expect moving forward. So I will go ahead and share the slides, Dr. Brummage, and you just tell me when you need me to move them forward. Just give me a second. All right, I will turn it over to you.
All right, thank you very much. I'm doing a quick sound check first to make sure that everyone can hear me. All right, getting the thumbs up from everybody. That's great. My name is Dr. Mike Brummage. I'm a native West Virginian. I went to WVU undergrad and medical school, and today I'm going to be talking about adverse childhood experiences and education. Next slide. So I'd like for you to just stop for a moment and think, what does it take to start with an infant with unlimited human possibilities, and in 2 or 3 short decades end up with a picture on the right, someone who might be homeless, with mental health issues, troubles with learning, substance use issues. And so really that's the basis of a thought that I had many years ago when I was in the military still, and brought with me when I left the military and came back to West Virginia in 2015. What are these things that happen? And I'm sure that many of you have heard of adverse childhood experiences by now. Next slide. It's almost everywhere now. Before, there was very limited awareness about ACEs, and a lot of times you'd start a conversation. Have you ever heard about adverse childhood experiences? And people wouldn't know. And nowadays, that's really changed. And you can see this is a screenshot from a 60-minute segment. Next slide, please. And it's even gaining some attention on the Hill, although from my perspective, not quite enough. And this is still a major area of concern, and an area where you still run into people who've never heard of adverse childhood experiences or understand its full implications. Next slide. So for those of you who already know about the ACE study, bear with me while I go through some of this information. It's maybe the most important study of which many Americans are unaware. It goes unrecognized in the pediatric exam room, shows up in the internal medicine exam room decades later. And the original ACE study done by Kaiser Permanente and Dr. Vince Felitti and Dr. Robert Anda from the CDC measured 10 categories of childhood abuse and neglect. And those are emotional, physical, or sexual abuse, emotional or physical neglect, and 5 categories of household dysfunction, where one or both biologic parents missing from the household, domestic violence, specifically toward the mother, mental illness, substance use in the household, and incarcerated members in the household. And there is a link that you can take to look at more information about the ACE study. Next slide. And why is it important? Well, it's linked to definite physical and mental health problems decades later. So you can see from this slide, compared to people with no ACEs, those with 4 or more were twice as likely to smoke, twice as likely to have cancer or heart disease, 6 times more likely to be depressed, 6 times more likely to have had sex before age 15, 7 times more likely to be alcoholics, 10 times more likely to inject drugs, 12 times more likely to have attempted suicide, and men with a ACE score of 6 or more were 46 times more likely to have injected drugs than men with no history of adverse childhood experiences. So really powerful factor and adverse physical and mental health outcomes later in life. Next slide. So population attributable risk. This is a kind of interesting oil blot graph that shows all these different kinds of dysfunction that you can see around the outside of this wheel. And the percentages on the inside, this is one way to think of population attributable risk. If we were able magically somehow to rid ourselves of adverse childhood experiences, that's what percentage would go away from that particular problem. So for example, drug abuse, if we were able to get rid of ACEs, 50% would just disappear. Life dissatisfaction, 67%. Intravenous drug abuse, 78%. So really, really important and profound effects on kind of the dysfunction that we see across society in many aspects. Next slide. So I'm going to just go through these very quickly because it's important to see how the questions are asked. I listed the slide, what the 10 different categories were for adverse childhood experiences. So here we go. Did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? Did a parent or other adult in the household often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Number 3, did an adult or person at least 5 years older than you ever touch or fondle you, or have you touched their body in a sexual way, or try to or actually have oral, anal, or vaginal sex with you? Next slide. 4, did you often, so this is the neglect questions, and they're subjective, but the way they're asked is important. Did you often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support each other? Number 5, did you often feel you didn't have enough to eat, had to wear dirty clothes, had no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctor if you needed it? So, emotional and physical neglect. Number 6, were your parents ever separated or divorced? One of the weaknesses with this question, it doesn't account for parental death. So, but the question is, as asked, ever separated or divorced? Next slide. Was your mother or stepmother, again, violence specifically toward the mother or stepmother, often pushed, grabbed, slapped, or had something thrown at her, or sometimes or often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes, or threatened with a gun or knife? Really tough question. And then the last 3, did you live with anyone who was a problem drinker or alcoholic or used street drugs? Number 9, was a household member depressed or mentally ill, or did a household member attempt suicide? And number 10, did a household member go to prison? Now, those are the 10 questions of the original ACE study. There are variants of those. There are other studies that have used similar or other measures of adverse childhood experiences. And it's important, if you ever look at studies, to ask which questions were actually asked. Did they use the same criteria that the CDC and Kaiser Permanente used in the original ACE study that was published in the American Journal of Preventive Medicine in 1998? Or have they used some other measures that are perhaps comparable? Because some of them have a 0 to 10 scale, others have like a 0 to 6 scale. In terms of this presentation, I'm talking specifically about that original ACE study I just quoted. Next slide. And so here you can see the long-term health consequences when you compare ACE score and a lifetime history of depression. And you can see there's a linear increase with your ACE score among men and women, but it's important also to note that women seem to be more affected by ACE score, and you would see that across the board wherever gender is broken down. So women seem to be more proportionately affected by ACE, by adverse childhood experiences. Next slide. Not broken down by gender here, but again, you can see that same relationship between ACE score and attempted suicide. Next. And ACE score and current smoking. big problem in West Virginia, obviously, as well as the other problems that we showed on the previous slides. Next slide, please. And here, ACE score and drug abuse. Is this important to West Virginia? Yeah, of course it is. So ever had a drug problem, ever addicted to drugs, and ever injected drugs? That same relationship still exists between ACE score and all of these measures. Next slide. I'm sorry that you can't see the bottom measures very well. I'll read it to you. These are ACE score and indicators of impaired worker performance. And I'm sure that all of you can associate with this. You've probably worked with people who have had absenteeism, serious financial problems, and serious job problems. And there is a relationship there with the ACE score and all of those measures. So ACEs show up also in the workplace. Next slide. The economic consequences are likewise profound. This is an older study now. It's hard to believe that I can say that 2012 is older. It talks a lot about my age, but it is a measure here that the lifetime costs associated with child maltreatment have been estimated at between $210 and $1.8 million per child. When you consider all the factors, I'm not going to read those to you. You can see those on the slide. But it's profound. So the economic burden is terrific of ACEs. Next slide. And likewise, economically, it shows up in the pocketbooks of people afflicted by ACEs. So you can see the reduction in annual earnings. Again, 2009 seems like ancient history now. But between obesity, teen pregnancy, and smoking, those are a reduction in annual earnings. But then when you look at child maltreatment, it's almost the combination of those three things alone. Okay. And thank you, Carolyn, for putting that in the chat. Videos and resources from the West Virginia ACEs Coalition. Next slide. So I've just spent the last 10, 12 minutes talking about adverse childhood experiences, but they don't happen in a vacuum. We also have to consider the other social determinants of health. And I love this tree diagram from academic pediatrics. And when you look at the tree that's above the ground, you see the adverse childhood experiences, the things that happen to individuals, but then below the roots and root causes of some of these adverse community environments, another ACE, poverty, discrimination, community disruption, lack of opportunity, economic mobility, social capital, poor housing quality and affordability, and violence. And in Charleston, violence is a growing problem. It seems to shootings and violent crimes seem to be happening more frequently. So these things there's an interplay between adverse childhood experiences and the community. I like to think about it sort of in a way that, ACEs are what happens behind the front door, and adverse community environments are what happens beyond the front porch. So these things have a powerful interaction with one another. Next slide. Oh, I think you skipped one. So one of the things I want to emphasize here is that because when an individual has a high ACE score, it does not mean they're predestined to poor health and mental outcomes. ACEs are a risk factor. Remember, we're measuring this at a population level, and it's sometimes difficult to apply. So you can think of ACE score like the social equivalent of a cholesterol level. Drug and alcohol use problems can happen in families with an ACE score of 0. So when we see somebody who's struggling with drugs or alcohol, you can't automatically think that this is a person who came from a troubled background, a bad environment. It's a risk factor though, and on a population basis, it's different. And again, we don't want to blame or shame parents for these issues. That's not helpful, and that's not the purpose of ACE scores. But on a population level, there is a clear correlation between this biologic connection between ACEs and health outcomes in adults. Next slide. So biologically, how does this sort of all play out? Well, we know a lot about the neurohormonal causes how ACEs play out in our bodies. So we think of this as the HPA, the hypothalamic pituitary adrenal axis. So we know that stress activates the amygdala, which then through the HPA axis increases the release of cortisol, heart races, blood goes to the muscles, digestion shuts down, memory is impacted. So I think the amygdala is the part of the almond-shaped part of the brain you can see on the right side of your slide. It gets a bad rap sometimes as the cause of problems, but really it's there to sense danger and external stimuli in the environment. It's doing its proper function. The trouble is when it gets hyperactivated from constant pressure and stress, then you see these adverse outcomes. And so here you can see what stress does to the brain. It remodels the brain, where you get atrophy of the prefrontal cortex, our executive decision-making processes. Would that have emphasis on learning and higher education? Yeah, you bet. The amygdala hypertrophies and then later atrophies. But then there's the hippocampus, it's Latin for horse, seahorse. And it's the part of the brain that helps, and many of you may know this, helps coalesce short-term into long-term memories. So it's an important part of the brain for developing long-term memory, which is, of course, is very important in learning. Next slide. And again, it activates the limbic system so that we get into that fight, flight, or freeze phenomenon when we get hyperstimulated from this childhood trauma. And these are parts of the brains that are involved, again, like I said, in learning, memory, reward, and reinforcements. And it regulates our hormones, our mood, our heartbeats, and sexual behavior. Things that we're seeing in grade school, middle school, high school, and then it shows up in higher education as well. It just stands to reason, right, that this doesn't magically go away over time. Okay, next slide. And it can impair healthy development. Part of learning is the ability to manage yourself emotionally, to be able to be in a place where you can learn. And one study revealed that exposure to relationship-based violence and trauma first 2 years lowered IQ scores at 5 and 8 years of age. So not really surprising, but sad. Next slide. And who are the people experiencing trauma? Who are these students? Well, they've been in foster care receiving child welfare services. They are or have been homeless, or have unstable housing situations. Homelessness is not always, we think of homelessness as living under a bridge, but there are people out there couch surfing from place to place and don't really have a home of their own. Students have been adjudicated. They've lived in poverty, unsafe and unsupported communities. I mean, you can look as an example of many communities, or one I think of always is the west side of Charleston. And that's just comes to mind. Or they experience frequent mobility. Children of migrant workers, military families, although these are really two different populations. Migrant workers, the military has a lot of resources for these kids. And so it's hard to kind of throw them under the same category as children of migrant workers. And you know, you might think of who else might be experiencing trauma in this way. Next slide. So we know ACEs impact learning. We've talked about it here, but here are some studies that really looked at it. You know, over half of, or roughly half of children with a ACE score of 4 or more had learning behavior problems in school, compared with only 3% with ACE score of 0. ACEs can affect learning behavior in the classroom. Children with 3 or more are 5 times more likely to have attendance issues, 6 times more likely to have behavioral problems, and 3 times more likely to experience academic failure. Now, a lot of these won't make it to higher education, right? They're going to hit their ceiling, maybe at high school or below, but some will. And I think it's an important consideration that, we know statistically that West Virginia is disproportionately affected by ACEs higher than the national average. And when we look at the mission of schools in West Virginia, I'm sorry, colleges and universities in West Virginia, we are trying to promote West Virginia citizens to succeed in the world, but they're coming in with this sort of weight tied around their ankles. And many of them are, again, on a population basis, not on an individual basis. Next slide. Again, ACEs linked to low grade performance, special ed, suspensions, and expulsions. Is any of this surprising to you? CDC found that students who had endured 3 or more ACEs are 2.5 times more likely to fail a grade. I mean, there's lots of evidence out there about the linkage between ACEs and school performance and learning. Next slide. And I'm going to just let you read this slide. I'm not going to read the statistics to you. And so what we see in the classroom as ADHD, these are often symptoms of childhood trauma left misdiagnosed, right? So these are, we say we have an ADHD problem. Well, this is masking a problem that is happening in the home of origin or in the community of origin. And, of course, part of social emotional learning is developing secure relationships with teachers, with classmates. And unfortunately, the traditional school model calls for disciplinary action over support or attention. And there's a terrific documentary called Paper Tigers about a special school in Walla Walla, Washington. I can see a lot of north-south head nods. That is very powerful about engaging kids. And it's hard, right? It's hard not to discipline kids. And at some level, there is a level of disruption that is impairing the ability of other students to learn. But it really goes back to what's happened to someone, not what's wrong with them. Right? And these kids are then often led into even greater isolation. And where they show up? They show up in emergency rooms. They show up in prisons. And so this is the harvest, the bitter harvest of ACEs. Next slide. So I screenshotted these. I apologize. It's a really cheap way to make a slide, but this is the one study that I found from this year, published this year, that looked at academic problems among college students. I hadn't seen this before. So we know there's a complex association between ACEs and academic performance, not well understood. So this study, which was a longitudinal study, looked at the direct association of ACEs on academic problems after 4 years, and with accounting for other academic risk factors, and trying to look at the possible mechanisms linking ACEs and academic problems. Next slide. So I won't read this number to you, 268 students, not a small sample. At a Midwestern US university, the majority were white, and you can see the breakdown there. And I'll let you kind of gradually read this. Participants reported their ACEs, intrinsic motivation, psychological distress, financial status. They looked at administrative records, prospectively over 4 years. They used structural equation modeling to test the research aims, and post hoc analyses without SAT or ACT scores were conducted. So what were the results? The results were that ACEs were associated with academic problems assessed 4 years later when studied in isolation, statistically significant result, but not after adjusting for other risk factors. So it was, 0.278, which is obviously not statistically significant. Psychological distress and SAT, ACT scores during the first semester predicted academic problems 4 years later. There was an indirect effect of ACEs on academic problems through psychological distress. Again, many of the people with the most severe ACE scores are not going to make it to higher education. They're going to be left behind. And one of the conclusions here, and I think it's important, the need to expand mental health services and address barriers to utilization on college campuses. So this is not probably a revealing statement, but it does emphasize that delivering these kind of health services can perhaps improve academic performance in higher education settings. Next slide. So what we're trying to do is, what I like to do is try to change the question of what's wrong with this person or what's happened to this person. Research should be conducted to find the best mechanisms to ask ACE and other sensitive questions. Primary prevention efforts will succeed when we start asking the right questions. We're just not asking the right questions. So why aren't students performing in school at all levels and at higher education? We know the effect of ACEs are profound, and the solutions won't be found in classrooms alone, but with the whole of society approach that really doesn't quite exist yet. I think that's my last slide, and I ran 2 minutes over, but hopefully that will leave ample time for discussion.
Thank you so much, Dr. Brummage. You are not 2 minutes over. That was great. That was great. So we definitely have time to take some questions. So please feel free to unmute and ask, or if you can't, use the chat feature. We're monitoring that. Carolyn did put a couple of links in there to the videos and also the link to the article that we talked about.
Hey, Mike, this is Carol Smith. How you doing? Long time no see.
Yeah.
I was surprised that the most recent study that you showed in the last slide in 2020 on ACE scores in college were not statistically significant. Yeah, once you accommodated all the other factors. And then your comment was, well, that's because people with high ACE scores probably aren't going to make it to higher ed in the first place. I teach counseling. I teach violence, loss, and trauma to master's level students. And we go through some of the ACE background, and my students have high ACE scores. They have 6, 7, 8, 9 ACE scores. So they've made it all the way to master's degree. Does it affect their ability to do the course? Well, I can say anecdotally that, yeah, they need a little bit more support. They do. I'd be interested to see this whole study done another way, because I again, just my gut and my career and everything are telling me, no, there are issues there.
Well, I think you're, and it's great to see you too, Carol. It's been a long time since we've spoken. The study was done at a Midwestern university, and I'm wondering what the overall burden of ACEs was in the community where these students came from, right? I'm guessing they were predominantly from communities close to that Midwestern, but that might be a false assumption. I think it would be bear repeating a study like that in West Virginia, for example,
Right.
Where there's
Absolutely.
a lot of in-state students at Marshall or WV or any other institute of higher learning in the state, or a multi site research study.
That would be interesting to tease out the differences on the various campuses in West Virginia. I mean, that would be fascinating. And no, I am not going to go get a grant to do that. I just don't have the time.
Cynthia, go ahead and unmute.
Thank you. And thank you, Dr. Brummage, for being here. It's great to see you. So I would love to just ask a question of the group, and maybe if you could raise your hand. How many of you do ACE screening within your practice of counseling students? I would love to just have a baseline for that, to see how many people are doing that. You could use the raise hand function or the. Okay. So we're seeing some.
But sorry, it depends, and everything is contextual. We don't do an ACE survey for all of our master students in counseling. And we certainly don't do it for all of our incoming undergrad students. I happen to show the ACE survey in my 682 treatment and trauma course, and then the students naturally take it, and then they tell me what their scores are. I don't even ask for the scores, they tell me. But this raises another question. Anda and Brown and somebody else here in 2020 published an article that said, please don't use the ACE survey as a screening tool for trauma, because it wasn't designed for that. I'll see if I can find it. I don't know if I can find it or not. But that is an interesting question, because it's the ACE score has kind of entered our zeitgeist. And there are questions about whether we should be using it or not. I don't think we should. I don't think it does a good job of really truly measuring someone's quote trauma load, for lack of a better descriptor, at the individual level. I don't think again, it's too blunt of an instrument. And it doesn't do anything to like weight or say, did this ACE category happen more than one time, or did it happen just one time? And then, okay, well, it happened once before I was 18, so that I get an ACE score, versus someone with an ACE score of 1, but it happened over and over and over and over and over again. Okay, those are hypotheticals, but work with me here.
Well, my name is
Dr.
Clemens,
Okay.
and I'm calling from Pierpont Community Technical College. And I use the ACE score as an augment when I'm doing an intake, just to get me some information. So, and then, when I see that, okay, this happened, and then I can use it to ask more questions in that direction. So I'm not necessarily using it per se, and I don't use it for everyone.
Yes, Suzanne, that was what I was really asking, is those of you who are doing counseling, are you using it as part of your assessment or part of your intake? I was just trying to get a feel for how much use is actually happening with our colleges, on our college campuses. Thanks.
I can just share that the way that I've used it hasn't been, on a regular part of the screening, but it's sort of intermittent when I think it can be a valuable tool to start the conversation, to increase the students' awareness about how what they've been through could have an impact on their lifestyle behaviors, to help them make connections. And then I always also talk about resilience too, and how it's not that life sentence, and that there's so many other things that can come into play. But I think it can be a really great tool for self-awareness.
Dr. Brummage, go ahead.
Yeah, I agree with all of those things. And I think that, the discovery of adverse childhood experience and then the dissemination of that knowledge has kind of led people to overlook that this was not intended to be an individual level tool. It was really intended to look at populations. And that's what Dr. Felitti did with his patient population at Kaiser Permanente in San Diego. And it goes back then to this idea that, right, it gives you great insight, but too many people, I think, were using it out of context and doing harm with it. And they were doing harm with it by, implying to people that, well, you've got this high ACE score, well, good luck, let's try to help you out a little bit. And that's clearly what it's not intended to do. So I think there's this sort of, discovery, ACEs, discovery, let's get it out there in the public realm so people understand it. And then there's this backlash, so the pendulum is swinging back the other way. Applying it in the appropriate circumstances to populations as a risk factor to talk about with individuals, just like you talked about, Dr. Baraka. You said, I mean, that's a great way, and Ms. Clements, that's a great way to use it as one of many tools to help understand the person sitting in front of you.
We had a couple of questions in the chat. They were kind of covered a little bit, but I want to give an opportunity for them to explain their question. Carolyn, do you want to go first about your question? You want to go ahead?
Sure. My question was really around whether you in your experience or anyone else on the call as well has seen any hesitancy to take this information and use it at either K through 12 or in higher education, or any resistance to the original study. And if so, are there strategies that you've seen work for getting the information across?
Go ahead. Yeah.
Well, I guess I would say that I'm not an educator. I'm not a counselor. And that's a sort of an important caveat. I'm a public health physician. In my role with Cabin Creek Health Systems, when I was their chief medical officer, we had a number of school-based health clinics, including psychological support. And this was readily embraced in the schools in which we had our school-based health centers in Kanawha County. And I know that there are others using this, but I can't speak to it outside of that. So I think it's a question for the group more than me.
Go ahead, Kara.
In my experience, I have had a little bit of pushback, but it isn't about the content. It's about having to deal with one more thing. It's just a time management issue. And people having difficulty saying, oh, this is something I need to pay attention to. This rises to the surface and is actionable. The only person I have encountered who, it was interesting, was in a committee meeting. He was a physics professor, and he absolutely rejected this whole notion that trauma could affect anyone. And then after the meeting, I'm not kidding, he was just absolutely adamant. And then after the meeting, he came over and he told me that he witnessed his father commit suicide. And so I was like, okay, all right, we could have another conversation later. But yeah. So yeah. So is there pushback? Yeah, but what's the pushback about? So, okay.
Yeah, and so I can take my in a very similar vein, Dr. Smith, my experience in the military. And so when I was talking in the military setting about adverse childhood experience, and this is why some soldiers may be experiencing, behavioral issues or disciplinary issues. And a lot of the non-commissioned officers had high ACE scores who themselves had succeeded, right? They maybe did overcome whatever happened to them. Maybe they had somebody in their lives that, cared and loved them enough that they were able to overcome those ACE, the ACE burden. But they saw then that because I overcame it, those people should be able to overcome it too, and they're deficient in some way because they themselves can't overcome it the way I did. And that might be the same dynamic that you talked about with the physics professor.
Dr. Brumage, that's a really good point, I think. And if I remember correctly, but don't quote me on this, that Edna Foa, a couple decades ago, did a lot of research on that with PTSD, why people get it and some people don't. And I believe that her results back then indicated that the people that had PTSD had a higher history of childhood trauma.
Let's see, we have time for one more question. I want to make sure, Sean, I want to make sure we got to your question. And if you felt like it was answered or not, if you can unmute, you can go ahead and ask it.
No, I felt like it was answered. It's more of a demographic thing than a personal thing. So you can adjust it in a setting or an area, but it'd be harder to adjust for each individual students.
Okay. Well, thank you for the questions. Thank you, Dr. Brummage, for the presentation. Great job. We really appreciate it. We'll make sure the slides go out with the links that Carolyn put in and everything for the recap. So don't worry about that. Everybody will get that. We're going to go ahead and move on to the topic discussion. So Dr. Smith, I know you wanted to be able to share your screen. You should be able to do that now. And so I can throw it to you for that to start that discussion off. You are on mute still.
Thank you.
Yeah, you got
Can you see that trauma-informed organization survey?
You got it. Yep.
Okay, good job. So I am professor of counseling at Marshall University. I'm also vice president of the West Virginia ACEs Coalition that Carolyn Canidi put in the chat for videos and resources. If you are not a member of the coalition, it's free to join, and it's a wonderful way to stay connected with everybody in the state who is working to alleviate the effects of ACEs with our children. We are working with PACES Connection, which used to be ACEs Connection, if you're all familiar with that. Mike, you're the one that actually introduced me to ACEs Connection. They are trying to do surveys nationwide to evaluate how trauma-informed organizations are. The West Virginia ACEs Coalition has partnered with PACES to see about using the exact same survey so that we, the ACEs Coalition, can identify sectors and geographic regions within West Virginia that could stand to have a little more training. And then we've got people that we're training to go out and provide that training. What are ACEs? What do we do about it? How do we avoid them? How do we promote resilience? All those kinds of things. So what you're seeing is this document, and the difficulty that I'm seeing with the survey is I don't know if it would fit for multi-layered organizations like hospitals and like universities that have multiple layers. For instance, at Marshall University, I have my little VOLT certificate, which is a subset of the counseling program, which is a program within the College of Education, which is part of the grad school, which is part of the university. And so the survey could be filled out by someone at any of those levels to see how trauma-informed the organization is. The milestones are pretty simple and intuitive. Have you all had an ACE presentation? Has everybody had an ACE presentation? Does the organization participate in any local ACE initiatives? Now that's not defined, it's just up to you to define what is an ACE initiative. Have organization decision makers publicly stated the intent to become a trauma-informed organization? Do you have a diversity, equity, and inclusion committee or department that's in your organization? Have all staff members received an ACE survey or a resilience trauma screening survey? So these are the kinds of milestones. You all can see them there. If I can figure out how to put the document in the chat, I will. Please forgive my technical limitations. So my question is this a survey that would make sense to distribute to the organizations that are represented by the Higher Education Policy Commission to be filled out? Now, the people who are collecting the survey information is being collected by two different bodies. One is the West Virginia ACEs Coalition to drive trainings and targeting trainings. The other is the PACES Connection itself doing national surveys to just track what's going on nationally. The same survey can be filled out multiple times. I don't know how many times or how frequently. And so this is just sort of baseline information that people are gathering. And so my question is this something that we collectively could or should participate in?
Kara, I will say, if you just want to email me that document, I can put it out and I can attach it in the recap if that's easier for you to do.
Okay. Let me see if I can figure out how, it's just me and just being old and clunky.
Well, in the meantime, does anybody have any comments about what Carol's asking about? So is this something that seems useful?
Carol, could you scroll up to the top of it?
Sure. Can
Thank-
you see it?
Yes, that's
Okay.
good. Thank you.
Now,
Carol,
in
I have
the,
a,
yeah,
go ahead. I have a question too, but
Yeah.
go ahead.
well, the sectors and subsectors, there are a gajillion options to choose from, like 30 or 40 options. And I just put in a for instance, education 12 plus, health, justice system as a sector, and then as a subsector, there was an option for state universities. They didn't have state colleges, but I think they don't, I think that's close enough. But then again, they did not get down to like college level, program level, you know, director of this center, director of that center. If this is good for universities to participate in, then let's do it. But if it's not, well, then I'm okay with that too. I'm just trying to figure out, if we were going to use it, how would we do it intelligently?
So Carol, I have a question. I'm going to put my higher education hat on.
Okay.
And say, if this were to be presented and or requested of colleges, for what purpose? So what would we do with the information? Because that's going to be the first question that's asked, is what would we do with it? How would we make things different if we had people answer these questions, and what resources might be available to them if they wanted to move forward in this way?
That's an excellent question. And the way the West Virginia ACEs Coalition statewide would use it would be to identify, are there places that are open to and welcoming and wanting ACEs training for their staff, for their students, for whoever, I don't know. That's the way it would be used at the West Virginia ACEs level. I'm honestly not exactly sure what PACE's connection is doing with it at the national level, except that I do know that their overall broad intent for this survey is to help states move towards being able to declare themselves a trauma-informed state. So coincidentally, because I'm into all things trauma, oh my gosh, it's just disgusting. I'm on a committee within my college, the College of Education within Marshall University, to educate all of our faculty on just exactly what Mike just presented on, the effects of ACEs on our students and their ability to do the work, and how do we respond to them. And we could conceivably use this survey in conjunction with that committee's work. But again, that's a very specific set of circumstances. And I don't know if that works for all of the other organizations represented on the call.
My question is along those same lines, just wondering, you know, there are people on this call from lots of different institutions, but they only represent maybe one program at their institution, or they may, you know, work in the counseling center and be pretty in tuned to trauma-informed practice, whereas they wouldn't be able to answer the survey for their entire institution probably. So what would it look like for this survey to be responded to by 15 different departments at any given school, would that be possible?
Evidently, yes. And you can, an individual can fill out the survey multiple times. You are asked to provide your name and contact information, I guess, for follow-up or for tracking. But there isn't any direction on, okay, you should fill this out once a year, once a quarter, and again, with a large organization that has multiple layers, there's no indication about, is the survey confined to just this one little pocket of the university, or is it for the university as a whole? Okay, in order for me to share it in the chat, I have to close the document. So, okay. But I can close the document once. Well, are you done looking at it? And I can put it in the chat. Okay, I'm going to stop sharing. Okay, stop sharing and close the document. Okay. Is this something even worth discussing? I mean, worth pursuing?
Carol, when I looked at the survey, I think obviously these are important questions that we want to have answers for at an organizational level. But I think that probably, I'm just guessing here, but outside of specific departments that are probably your counseling and your social work and your psychology departments, from a whole organizational perspective, there's probably been very little attention to this. Right. And so maybe the first couple of questions are really the most important questions and are teasers of, and if you haven't provided any education, the West Virginia ACEs Coalition can offer this, and this.
Right.
And maybe they're, rather than replying to a survey, they are to bring awareness to what's there and what is available as a way to start. And right. I'm certainly open to, if anyone has a different experience or thinks it would go differently. I just don't think that there's been a lot of attention at whole organization levels, and maybe a place to start is with getting this out to presidents and student services directors as a way to start of, this is what's available, before we ever start thinking about, let's survey what people's experiences have been.
That makes perfect sense to me. I mean, when this was handed to me, I thought, okay, well, this is lovely, but like, what do we do with it? Mm-hmm. And the silence that I'm getting back sort of underscores that maybe we're not ready for this level of survey, at least not at this point in our existence as a country. But it is a way to open a conversation for further investigation. I'm just trying to figure out, if we were to distribute it, and the link, by the way, to the actual survey, if you wanted to take the survey, is actually in the chat too. Carolyn Canini put it up there. It's WV Partners. It's a bit.ly address. It's up to you if you want to take the survey and just give them some information. I'm not sure what, I'm honestly not sure how well this is going to work with universities. I think it is potentially better for like individual schools to fill it out. There is a parallel survey for government agencies as well that probably ask very similar questions. And this, again, this initiative originated with PACES Connection, and the West Virginia ACEs Coalition is partnering with PACES Connection so that we can use this information to do a better job of targeting where training is needed. Yeah, Mike.
Yeah, I put it in the chat. So I did something like this. We did something like this at the Kanawha Charleston Health Department way back in 2015. And but we set the stage by explaining why we were doing it, right? And I think that's really the first step. If you want to do it if it's it to be a valuable tool is to set the context, and that way people understand why are you asking these questions? These are deeply personal questions, and what will it tell us? And I think, you know, if people understand the why, they're much more likely to participate in determining, you know, that, well, here's what we're going to do with the data. You know, why are we doing this? And here's what we're going to do with the data.
Right.
And we're not, you know, you can take it anonymously, you know, so that, you know, you're not going to be revealed in some way, to mitigate the harms from asking those questions.
Yeah, again, because I'm not the originator of the survey, I'm not sure whether those are required fields at the beginning where you identify yourself and provide your email address. I just don't know. But yeah, to contextualize the use of the survey makes perfect sense. And Cynthia, I liked your idea of reaching out to, you know, either presidents or you know, directors of student affairs to see, hey, is this something you all would even find, you know, interesting, worthwhile, and applicable to your university? Yeah. I appreciate the feedback.
And Carol, like you said, when you were talking about the education you do with students, you don't want this to be one more thing, right? You want it to be something that people understand the value of, but also know that they're not alone in trying to figure this out and that there are resources available.
Right.
And so perhaps just a couple of introductory thought-provoking questions, and then what's available to help if they should choose to move in this direction in any way, would be a good first place to start.
Yep, that makes sense. I appreciate the feedback. I really do. Because the West Virginia ACES Coalition is a new organization, and we're trying to, you know, build the airplane while we're flying it. We're very gung-ho. We've got this survey, and when I started trying to conceptualize how do you use it, the questions that you all are raising kind of bubbled up in my head. And I reached out to Carolyn Canini, and she said, well, why don't you bring it up at the next meeting? So now I've got the brain trust here. I really appreciate it.
We're glad we could bring the brain trust together and help you out. No problem. We'll definitely have the link and a copy of that in the recap. So please take a look and provide feedback like Carol was saying. That'd be great. We're a couple of minutes out. Just to kind of wrap things up to make sure everybody gets out of here on time. We're going to meet. Our next meeting is a little bit different. It's going to be January 10th, and that's due to the holiday the week before. So we're going to meet January 10th. Same time though, 12 to 1. Your Zoom invites and everything like that doesn't change. Just use what you normally use. It'll be fine. We will have more information on the topics of the second half here, January through June, I believe. We have some working titles and things like that, but we'll come out with more details on who's going to present them, what the topics are, things like that. And yes, just like Carolyn said, please submit some discussion topics. Again, they do not have to be earth-shattering detail or anything like that. Just a question you might have that you want to throw to. I think we're going to start using the brain trust term since Carol said that, you know, throw out to the brain trust. So any additional comments or anything like that before we wrap up?
I just appreciate everybody's time. You know, it's such a hectic time of the year. Thank you for helping out with this. And Mike, thank you so much for the presentation. I mean, we know this, but it's really good to see it and have it underscored.
Yeah, we really appreciate Dr. Rummage, your time, Carol, for talking about the survey. Really appreciate everybody attending. Have a great holiday season. We'll see everybody in 2023.